Yes, sir. Yes, sir. You're audible.
Okay.
Vinodji, you can start.
Good to go now? Yes, sir. Right.
Yeah, yeah, yeah.
A very good evening and namaste, everyone. A warm welcome to the very second session of Naturopraman, Yoga Jignasa, the exclusive sessions of yoga and naturopathy by the eminent speakers of naturopathy across the country on the occasion of International Yoga Day 2023 by Jignasa team. So let me quickly introduce about what is the Jignasa is all about. It's empowering Ayush students from the campus to the community, becoming a bridge between the Ayush students and policymakers as well as administrative authorities, connecting every aspect of Ayush, students, academicians, practitioners, scientists, industries, and hospitals under one umbrella. So we talk about Jignas as a wide spectrum. So let's think globally and act locally. The last 2 decades, our efforts to strengthen Ayush education system and boost confidence among Ayush students, Jignas initiated various programs in different parts of the country, from the grassroots to the international platforms through the discussions, study circles, seminars, workshops, and conferences. So let's quickly look into the 2 decades of an eminent things which Jignas has done, like study circles, lecture series in specific topics, free medical camps, social health survey status, followed by hands-on training workshops, conferences to explore and learn unique aspects of Ayurveda, interaction with eminent Vaidyas and academicians, brainstorming sessions with Ayush stalwarts, policymakers, and key stakeholders of Ayush system, natural yoga, Arogya Expo International Conference, national seminars, medicinal plant visits, pharmaceutical visits, and so on. And there's a lot of other various things which Jignas has been doing on a day-to-day basis, and also been agitations for the demand of Ayush students community. Private internship programs for interested students to learn from acharyas, interaction with the traditional healers, and visit to explore the regional flora. So, and also been conducting a lot of online mock tests, social awareness programs, and free health camps as well. So this is all about the Jignasa. Now, without further delay, let's quickly welcome our eminent speakers on today's session. It's going to be Dr. Rajesh Kumar Singh, sir, who's been and having an eminent personality of yoga and naturopathy physician, entrepreneur, author, speaker, celebrity life coach, and also is holding on various designations in the past and the current, wherein is holding as an current roles of National Vice President, Enigma, Member, National Board of Promotions and Development of Yoga and Naturopathy, Director, Samati Natural Naturopathic Wellbeing Center, Director, Samatwa Wellness Private Limited, as a Director as Atta Wellness Private Limited. And also is being in various roles of the past of National General Secretary, Enigma, Member Secretary, Executive Organizing Committee, International Congress on Naturopathic Medicine, Director Operations at Kailash Health Village, Noida, and also is being into the Syrian Wellness Executive, Rosewood Hotels and Resorts, Virgin Islands, United Kingdom. So Sir has got on various other important roles where he's also been worked as a group spa supervisor, Prem Kamal Spa Super Indies, and also is being into a residential medical officer, Bapu Nature Cure Hospital and Yogashrama at New Delhi. And Sir is completed with BYNS, that's Natural Master of Naturopathy and Yogic Sciences from the Rajiv Gandhi University. And he also has been an author as having an additional personality of Who's Who Yoga and Naturopathic Medicine in India. So with this, all this, Sir has also been completed a lot of other wellness projects as a consultant at Kailash Health Village, at BNCHY Wellness Medispa Delhi, Samati Naturopathic Wellbeing Center, Greater Noida, and ITS Naturopathic Center, Muradnagar. So, with this, sir, we heartily welcome on behalf of the entire Jignasa team to this great session on the second day of having this International Yoga Day session coming up very shortly on this. And sir is going to have an talk about a very, very important topic on today's thing, which is going to be return to nature in perspective of yoga and naturopathy. So once again, welcome to the session, sir, and over to you, sir.
Thank you. Thank you.
Thank you, sir.
Very elaborate kind of description of Jignasa as well as myself. So thank you for introducing me to this uh, wonderful thing. And here I have to present you the basic understanding of what is yoga and naturopathy. Uh, when you look at the modern lifestyle today, we are plagued with a lot of lifestyle disorders, metabolic disorders. More and more we see the autoimmune conditions. More and more we see stress driven uh, disorders, psychiatric illnesses, mood disorders, digestive issues from indigestion to hyperacidity to constipation to IBS to colitis, and the kind of conditions and the kind of people which we see on a daily basis. We understand that there is something wrong in our lifestyle, there is something wrong in our food habits, there is something wrong in our sleep patterns, there is something wrong in how we are thinking, there is something wrong in how we are feeling and how we are exercising. So there are multiple factors what we know as lifestyle factors, and yoga and naturopathy fortunately is one of those systems of medicine which completely focuses on your lifestyle, on your diet, on your sleep, on your stress reduction, on your physical activity. And just by doing the right measure of these, we are able to bring back uh, majority of autoimmune conditions, majority of the metabolic disorders, majority of the endocrine issues, the orthopedic complaints. So when you look at these lifestyle factors, these are very important and powerful factors. Now, if you ignore them, you get diseased. If you follow a right kind of pathway, even after you are severely diseased, there is a chance of complete reversal of that condition. And that we do through a system of medicine called as yoga and naturopathy system of medicine. Now, this yoga and naturopathic medicine is very unique to India. I mean, uh, naturopathy is practiced in close to about 90 countries around the world, but none of them have yoga as a component. Whereas in India, it's known as yoga and naturopathy system of medicine, and the doctors uh, earn a degree of Bachelor of Naturopathy and Yogic Sciences, and then get registered as uh, qualified yoga and naturopathy physicians. Currently, we have 75 colleges offering this specific degree, and then many of these graduates also go for post graduation MD programs in clinical yoga, clinical naturopathy, clinical acupuncture, and energy medicine, and then nutrition and dietetics. So these are the four disciplines under which our postgraduates are being produced. Now, you go from the whole Ayush perspective. Yoga and naturopathy is only proclaimed drugless, non-pharmacological uh, kind of treatment which is available on this planet. Though we might prescribe some simple herbs or some minerals or some vitamins or some essential salts, but largely we are not prescribing medicines per se, not at all the chemical ones. The in spite of this, that our tools are limited to the lifestyle factors, the results have been phenomenal. We have got a good following around the world. People look for naturopathy as a reliable lifestyle method to get rid of diseases, to lead a healthy life, and to even lead a very objective uh, purpose for the life which it can give. Now, coming to yoga. yoga gives us much more than that. It's not just gives you the physical health, but it also talks about your uh, the improvement of your mental and spiritual faculties. Now, yoga and naturopathy put together, they become a complete science around which a life can be healthy and more productive. Of course, there are problems which come in between, which we also treat, and we are treating very difficult, long-term, chronic pain disorders or chronic lifestyle disorders, metabolic disorders. The people have already given up on their hope that they can ever be cured, but they can be cured by just correcting their lifestyle. So uh, I wanted to give you a very brief understanding of what yoga and naturopathy system in medicine in India is, and you know that yoga has multiple of its practices. Now, as a yoga and naturopathy physician, I need to understand a medical condition. I need to understand sometimes just the physiological condition of the body, and also set the goals of my patient, my somebody who wants to learn yoga, and then we design a yoga program which suits every individual. So majority of our doctors are designed, trained to design such protocols for the people, and through that we are making the life much more meaningful and purposeful. Understanding the yoga's potential in addition to the naturopathic principles of health and well-being, I think it's a great combination which India has to offer throughout the world. So with this, I welcome questions or further conversations or debates, discussions from any one of you. Um, I think the chat box is also open. You can ask me a question as well. So we take this discussion forward. Okay, till the time uh, this question comes, uh, I would like to give you some further details about what a yoga naturopathy physician is supposed to be doing. Uh, Number one, he is a different kind of physician, where the tools available with him are all, as I said in the beginning, in the lifestyle, in the diet, in the sleep, in the exercise, physical activity routine, in how emotionally you feel or how you are emotionally established. So uh, these are the tools which are available with us, and we are the we are the most scientific system of medicine. We call that, we would like to be current with science. We try to incorporate all our traditional methods into a scientific framework, understand that anything which is not scientific today is something which requires either the work, further work to be acceptable to everyone, or we would adopt more and more practices which are established by science, which are accepted by science. So uh, we talk in terms of science, we talk in terms of progressive uh, uh, understanding of the medical science in current terms, so that we can address many of the conditions which are uh, not being appropriately treated, not being appropriately addressed by the modern medicine. Now, when we look at modern medicine, in spite of its reach, in spite of its influence, in spite of its economy, is not able to help people who are chronically diseased. It creates a kind of burden. Once you are diabetic, then you get into a chain of multiple other metabolic disorders to start, and then you get into the diabetic complications, And more than that, diabetic complications, you can say that diabetes also causes comorbidities, which means that other conditions also can be found in those people, like, for example, the the number of infections, the susceptibility to the infections, viral or bacterial infections, increases in any diabetic patient. Similarly, a diabetic patient can have a frozen shoulder more likely than those who are not diabetic. A diabetic person can have a kidney condition or kidney failure more likely than those who don't have diabetes. uh, a diabetic person can have hypertension more likely. So there are multiple conditions. Then you develop a condition of skin or a joint, or so multiple such things can happen. Now, if you look at the progress of disease in diabetes for those people who are already under medication, and for those people who are not under medication, the prognosis is no much different. The reason why prognosis is not different is because they continue with the same diet, the same lifestyle, with or without medications. Now, as a yoga and naturopathy physician, when a person with diabetes would come to me, my primary responsibility is to understand how his sugar level is raised, why it is raised. Is it uh, the activity which is not there in him, or is it some autonomic nervous system overactivity, some stress factor, or some endocrine disturbances, or it is simply a case of metabolic disorder where sugar level is raised and you just need to manage his diet. So, through all angles, I would like to see his diabetes and treat him so that he is out of that problem immediately. Like, majority of the patient respond within 7 days. Some people may respond in up to 2 months, but majority of the diabetic conditions can be reversed. Now, there are multiple tools through which we will do that. One is definitely diet or fasting, but uh, we would also like to see and measure his activity level, his stress patterns, and we would also like to see the other metabolic parameters in his blood so that we understand his life a little better. We analyze the risk factors, we analyze what other problems are coming in his life and how we can prevent them. So it's a very beautiful approach where you work with life in detail, and yoga as a lifestyle, starting with activity, starting with stress reduction, or regulating the breath, or you know uh, improving his sleep. So all that, there is something called as circadian rhythm in lifestyle medicine that's very, very important. So if you don't sleep at the same time and don't wake up at the same time, or you don't eat at a fixed time, or you don't go for activity at a regular interval, then many of the body's normal natural processes start becoming defunct, and sometimes they start getting disturbed with the thoughts or the stress patterns more aggressively than in those people who have a very regular routine. Now, this routine is important to maintain majority of our metabolic functions at the optimal level, your energy at a higher level, your mood at a good mood. So if you are able to do that through a regular routine where you have the allotted times for food, allotted times for sleep, allotted times for exercise, and allotted time for some kind of recreation, some kind of amusement, and with that we can do everything else much better. But when you don't have time for activity, or you have no time to eat, or cook a meal, or fix a meal, or think about your meal, then actually you end up eating things which are not necessary by your body, then you end up sleeping less, which is the most important break for your nervous system. Then you start ignoring your body, and you become lethargic, potato, couch potato. And then you start getting multiple of these conditions very quickly in your life. So we see that, with sedentary lifestyle, with a corporate kind of, jobs, and very pressured, very mind driven, but no physical activity, and you can eat and you have no understanding of what you are eating or drinking, and going very late from work, or sometimes sleeping very late, or watching a movie, thriller movie somewhere around 3 a.m., and then trying to go to the work at 9 a.m. So this is a kind of hectic life which does not have anything allotted. So you try to find time for everything, like, you have your daughter's birthday, so you try to pull out of your office a little early so you can attend the birthday. You don't actually have the time for your daughter's birthday. Similarly, when you want to sleep, uh, you don't have time to sleep. Actually, you are in a rush. So everything which you do, and even at office, even if you spend 15 hours at office and 4 hours in traffic, actually you're not being much productive. And the reason why you're not productive, because you're not feeling good at yourself. You cannot finish your work in a shorter time. You're not attentive, you're not focused, and your body is not supportive. So now when you start dealing with the lifestyle disorders, some of these things we have to understand, that those people who have more of a life which is not disciplined, which is not programmed, which is not routine, are into a bigger problem. And those are the bodies which are going to develop a metabolic disorder, or a stress disorder, or a joint disorder. So if you start changing your lifestyle, if you start treating your body properly, if you start feeding it the nutrition which it needs, if you start avoiding things which it does not need, if you start giving it exercise, then your body blooms. And not just the body. With yoga, we know that, the mind has immense possibilities. It it can find its own peace, it can find its own solace, and it can find much more than that through yoga. So now, yoga and naturopathy put together prescribe you a lifestyle which is most suitable for this modern day conditions, this modern day lifestyle. And this is high time that we understand that we have to make the best use of this body, make the best use of your mind while you are on this planet in this birth. And that is why yoga and naturopathy as a very important tool, gives you the guidance, keeps you covered, and keeps you protected all the time. Yes, Vinod. um,
Yes, sir.
yeah, so would you like to ask any question, or you want to just, like, do some thought provoking thing?
So you can, I think it's been quite interesting even listening to your, kind of information which you've been giving to us. So just want to know, are you done with the session or you just want to continue more?
No, no, we can continue.
Okay, sir. As of now, no questions, sir.
Okay. So now, looking at yoga and naturopathy is a system of medicine. Um, we I don't know how many of you have heard of a place called as Jindal Nature Cure Institute in Bangalore. That got established in 1989, and since then it has been one of the places where the uh, the rich and powerful of India have been going for last 35 years. And the reason is that they see those people who have visited Jindal, they understand that there is something changing in their body. There is something changing in their lifestyle, because all this life they have lived a life, and just by getting admitted there for 10 days or 15 days, they understand that the body starts feeling better. And the reason why the body starts feeling better, because you eat a lot of greens, a lot of your fruits, maybe drink a lot of coconut water and juices, or just lemon honey water, and eat a wholesome meal which contains less of grains and more of the natural ingredients. And then your body gets detoxed. At the same time, you get enema, mud packs, steam baths, and then you get massages of different kind. Then you are asked to walk, and then you are asked to go for a yoga class. You do jalneti, you do sutraneti, you do bhastrika pranayam, and then you stretch your body. Then, so this very generalized approach to wellness has worked for a lot of conditions already. We know that there are range of metabolic disorders, there are ranges of other conditions where people immediately get benefited by just getting introduced to this new lifestyle, which is so valuable for the body. Even if you do that once in a lifetime, sometimes, like once you go for 10 or 15 days in a life, maybe that is a life changing experience for the remaining part of the life for those people. And all the sins, all the mistakes, or the crimes done to your body or done against your body, they all get pardoned by just keeping your body, giving it a chance for a few days. Now, understanding that this is a huge area of improvement for all of us. Are we sleeping enough? Are we exercising enough? Are we eating the right kind of meals, right kind of nutrition which our body is demanding? Are we rejecting that which your body is rejecting? What is happening at your thought level? What is happening at your emotion level? What is happening with your sleep? Now, looking at these factors as very important aspects of our life, looking at these factors as the most important aspects of our life, which actually easily convert into all our experiences. Now, if you are watching a movie with a back pain, what kind of entertainment is it? You have a severe back pain and you are trying to watch a movie. So you are not actually able to watch the movie with all the purpose of watching a movie, or giving you a kind of entertainment. The reason is you have severe back pain. Similarly, if you are eating something which immediately makes you bloated or hyperacidic, you want to vomit, or you get migraine, then who are you feeding it for? Is it the same body which is not feeling well after eating this, and still you're feeding your body that same thing? So what are you feeding it for? It's not the body which is demanding it. So it's there is something more than that which we are missing, and that is understanding our body, understanding our mind. And if the food is the one which creates this body, in yoga we call it as annamaya kosha. Everything which uh, gets created by the food and drinks which we consume, that is annamaya kosha, or the physical sheath of the body. Now, this body is completely dependent on the nutrition which you provide to it. Now, if you provide it a bad nutrition, then the body starts behaving badly. Now, if you provide it with good nutrition, it starts working like a very well oiled super engine. So, Now this is something which you have to understand, that this body has uh, very simple mechanisms through which it is telling you that you are not well, that you are not doing well, that you are in pain, that you have this discomfort. But if we are continuously ignoring those symptoms, those signals, not asking for help or not correcting our lifestyle, then it gives you bigger problems. So naturopathy and yoga as a lifestyle actually is aimed to create you more healthier societies, more healthier persons, and in the process, if we have to address any medical condition, we address it very scientifically, we try to give a supreme authority to the body's healing capacities, and we believe that there is nothing more powerful than your own will to get better. And once you accept that I have to get better, then you look for the right kind of nutrition, you look for the right kind of advice, you look for the right kind of nutrition which your body needs, and you get better very very simply. So this is what in nutshell the naturopathy is. Now we as doctors are trained to identify your problem, to understand the language of diagnosis the same way an MBBS or MD doctor learns. We learn actually pretty much the same subjects of modern medicine in their language to understand the conditions of today. And then we apply our natural therapeutic methods, whether it could be a deep relaxation method or a breathing practice or a kriya or a physical activity, or we advise you on diet, and then we advise you on the other cleansing methods of naturopathy, and then we might also give you some treatments like manipulative therapies where we might do massages, or we can adjust your spine, we can work on your postures, we can or we can reduce pain by just giving a few days of acupuncture. But none of these methods introduce any chemical to you. None of these methods, if done by qualified practitioners, and I need to say this very very strongly, there are a lot of people who claim to be yoga therapists or naturopathy physicians or yoga and naturopathy practitioners, but if they are not qualified enough, if they do not understand the science behind yoga and naturopathy, if they do not understand the clinical applications of yoga and naturopathy, if they are not qualified from a university which is designed to make doctors, if they are not registered uh, or not registerable in any state medical board, then please do not talk about your health issues to them. Talk to only qualified people, talk to only people who understand the science of it, talk only to the people who are properly qualified. Unfortunately, the traditionally the number of qualified yoga naturopathy physicians in India have been very low. Uh, that is a kind of thing which is also present around the world. Uh, in Canada and United States, naturopathy is more like a accepted practice. In yoga and naturopathy, in Ayush sector, we are currently the fastest growing system of medicine. Currently, with 15 states having yoga and naturopathy colleges or universities, and in those 15 states put together, we have close to about 75 medical colleges of yoga and naturopathy. But and these together produce close to about 3 to 4 thousand doctors every year, in from this year onwards. So far we have been producing between 1000 to 2000 for last 5 6 years, and before that we were in uh, hundreds, we were producing in hundreds. So now, after 75 colleges, I think the number of graduates in next 5 years is going to be close to about 30,000 graduates in next 5 years. So we are going to be a very formidable system of medicine. We already run the largest number of hospitals and largest number of beds, actual beds occupied for treatment in entire Ayush systems of medicine. So our hospitals attend a large number of patients for serious illnesses, and they are spread across Karnataka, Tamil Nadu, Rajasthan, Gujarat, Uttarakhand, Uttar Pradesh. So name a state and you'll find a yoga naturopathy hospital. The standard care of yoga naturopathy uh, through a qualified yoga and naturopathy physician, and it's getting spread widely. So uh, there is also a chance of integration with other systems of medicine which are uh, um, agreeable to us, and in that process we think that the panchakarma part of ayurveda, or the prakriti analysis part of ayurveda, or simple herb application, or can be also combined easily with naturopathic practice. Similarly, in West, the homeopathy is a companion system of medicine for most of naturopaths. Similarly, Unani and Siddha and Tibetan medicine, none of them have any direct conflict with yoga naturopathy. So while we think that we are uh, good enough in treating multiple conditions, but we have also a possible interaction, possible possibility of cooperation, and many of these hospitals are already incorporating some of these services, some of these aspects of complementary medicine from our other Ayush counterparts. So I believe that in the future of medicine, the future of healthcare is going to be heavily leaning towards the natural methods of treatment, including yoga and naturopathy, and we see the result of that kind through the promotion of International Day of Yoga, especially our Prime Minister's resolve to take it to the United Nations, especially his resolve to attend this year's uh, special program on Yoga Day at United Nations with UNGA president and multiple presidents of multiple countries. Uh, Similarly, he's resolved to be present in major Indian cities across the nation on International Yoga Day and leading the show from the front, deputing all his ministers to different states uh, to celebrate Yoga Day, to do programs in the run up to the Yoga Day. I believe that this is a kind of thing which Prime Minister has resolved, that yoga and naturopathy has to become every human being's practice. It becomes every human being's lifestyle choice, and that is the reason why we are educating and motivating more and more people to adopt yoga and naturopathic lifestyle. At Indian Naturopathy and Yoga Graduates Medical Association, which I represent as its national vice president, I believe that yoga and naturopathy as a system of medicine will have a very promising role in the entire healthcare industry of India, because more yoga and naturopathy is adopted by the people, the less the cost on the health, the less the cost on their medical expenditure bills, and less the cost on the nation. So with this, I believe that if you have any question, you can shoot it. I try to give you a brief understanding of what yoga and naturopathy is overall, and with this, I would like to conclude this.
Thank you so much, sir. Thank you so much for sharing your, complete knowledge and the information about the yoga and naturopathy. And definitely, it's been, and we're taking away with your knowledge of how exactly we can incorporate or apply in a day-to-day life of these lifestyle disorders, what we call it across in yoga and naturopathy, being a vital role. And it's been a very, very pleasure in having you on this session. So thank you so much once again. And I also thank you on behalf of the entire Jignasa team for having you in this session. It was really wonderful and informative to have you on this one. Thank you so much.
Thank you.
Dhanyavad, sir. Uh, Before we end this today's session, I just want to inform you, everyone saying that tomorrow we have another session coming up, which is going to be very exclusive on naturopathy. So please stay tuned with us, the Jignasa team, and join us tomorrow at the same time. Thank you so much. And Dhanyavad, everyone.
Thanks everyone for joining. We'll end the session now.
Yeah, okay, thank you.